Yeah, tired, wired, spacey headache. So we're going to spend a few minutes. This is a very, very important topic. So people can have one of these symptoms, all of these symptoms, in order, sequentially, at the same time. More often, though, it's one at a time. Or a person might only have one or only two. The two most common are spacey and tired. Probably then headache, then wired. Let's go over each one of them. So tired is sleeping, basically. I mean, real tired. When you present this and you go over this with patients before you're treating them, they'll say, oh, I'm already tired. Or I'm already spacey. Or the medication makes me this way. The point is, are you more tired than you are right before you started treatment? That's the reference point. So it doesn't matter if they came in tired. Are you more tired than you were when we started? Tired may start subtly. It's sometimes experienced as just a heaviness in the eyes, or they may start to yawn. Sometimes it's a little confusing between being tired and just relaxing. They're not always sure. Most often symptoms will come on during a session. It can be a few minutes later, half hour later, a few hours, and occasionally not till the next day. The onset of symptoms, the timing, whether it's a few minutes after the treatment or a few hours, it stays consistent. So during my first few sessions, as I figure that out, that's one thing I keep track of in my notes, is when is the onset of symptoms. So tired. Wired is usually, is two versions of it. One is slightly giddy, almost like a mild hypomania. They're laughing, they're having a good time. If they're depressed, they love it. The other form of wired is anxious. I find the hypomania more common than the anxiety. Spacey can be like a little woozy, like you've had a drink or two. Most people, well, about half the people find it fairly pleasant, especially if they have a history of drug use in the past. They generally find it pleasant. What's important with spacey is making sure the person can drive home. So I often recommend that they come with someone the first session. But most of these symptoms last only from a few minutes to a few hours. It generally really is just minutes. So even if they feel spacey, you can just have them wait for a little bit. Sometimes I have them take a walk around the block. Or headache. Often the headache is not even really a headache. It's just a very mild pressure. So very occasionally, the headache can be a real problem. You can take anything you want for the headache. There's nothing that you particularly have to do when you get a treatment, and there's nothing you particularly need to refrain from. And then there's nausea, which is pretty straightforward. So if this is the first session, they have any sign of this, you just stop. Done. Done.
No matter how mild or anything.
Right, you just stop because you don't know how much it's going to build now. You don't know what it's going to do over the next half hour. It may peak in the next minute or it may really build and be a big problem a half hour later. So the first time, till you know a patient better, you just stop first sign. How you ask, there's some specific ways you have to ask. Because it's not helpful to say, how do you feel? It's, are you different in any way from a moment ago? Now, sometimes when I say that, they don't, including relaxation. You have to say including relaxation because they won't think that that's different. They won't really they may not be paying attention to that. So it needs to be that specific. Are you different in any way, including relaxation, than a minute ago? On the positive side, sign of improvement, by far what's most common is relaxation, calm. And that's really what you're looking for. It's not necessarily that you want them to feel relaxed, like they've had a massage, which it's nice, but it's really indicates that they've received the proper amount. Something I just call that happy brain. They may also begin to experience, they may be cheering up, or if they came in tired, they may start to feel more awake. They may have visual phenomena. Things might be coming clear all of a sudden. They may be cheering up. And basically having an actual response these are the criteria by which you decide how much to give a person. They may also experience a tingling, and it can be anywhere on their body, even their hands or feet. Or warmth, which would be parasympathetic response, the dilation of blood vessels and feeling of warmth. They usually experience warmth. If they do experience warmth, then relaxation usually comes a little bit after that. Sometimes you'll see a sigh, and it's an involuntary sigh. I find when they give the sigh, they usually still don't realize they're relaxed. That comes a minute or two later. And some people are just much more self-observant than others. So you're using visual cues as you're doing this also. That covers a lot of what you'll see, most of what you'll see. There's another whole category now that's very, very interesting. We call it release of compensation. Release of compensation goes something like this. Let's say you had a facial tic when you were young, and then your brain learned to compensate, and the tic went away. Stutter. Almost anything. And what may happen when you do this is that the tic will come back. The stutter will come back, which will really naturally upset the patient, which is why you have to mention this ahead of time. So that's the other thing. You know, did they ever have a stutter, etc., when you take the history? Anything from the past, but it's important to tell them. So the tic will come back, but it's only temporary. And now, it's always temporary, 100% of the time. And now, instead of compensating for it, the brain will process it. And it goes away in a more thorough way. But this can be anything from the past. It can even be a physical pain. One way I sometimes see it is anger. Someone who used to have a bad temper, then learned to control it, will suddenly get angry. Now, this generally only happens after the first or second session, so it's not going to happen way down the line. It can last from a few minutes to a few hours, to sometimes a few days. Well, memories come back.
Like traumatic memories.
Right. My experience is that they come back with a physical sensation, and so they'll come together. There's one woman I had who had been in a terrible car accident, and she had been hospitalized, and she was briefly paralyzed on one side, and this was a few years earlier already, and I treated her, and that night she became paralyzed again and returned. Now, I had warned her, so she wasn't worried, and so she didn't call me, and I'm really glad she didn't, because I would have gotten worried. But it turned out fine. It was just a more extreme example of release of compensation. So this will be something from the past that is no longer there. This is not a current symptom. There can be a flare-up of a current symptom. And you don't see it that often, but you will at times. You definitely will at times. And it's good to, you need to be aware of it in case that is what's going on. Now, when you treat a person for the first time, I mean, what you're most aware of is not overstimulating them. The focus is on not overstimulating. It's not on getting them better, because they will. Your focus should be on not overstimulating them. Now, the easiest people to figure that out on are when they respond right away. Like right then, you give them a signal, and then a second or two later, they experience whatever it is. But you don't know who that's going to be. But most people are. And certainly if they're sensitive, they virtually always are. Though I've had a couple that were quite sensitive but didn't exhibit symptoms till later. And that can easily become a problem. So even if it's for a half hour, a few hours later, it's easy to give someone too much. So you don't know if you're treating them and they're not responding because you haven't given enough, or you've given enough or maybe even too much, but they're not going to notice it till hours later. So that's the reason it can take 2, 3, 4 sessions for someone to respond. It's because you may not go high enough for what they need. But you don't go too high in the beginning, and that's particularly true if they're not hardy. This is where hardy comes in. So based on their hardiness, on how sensitive you think they are, you limit how much you're willing to go. You also, it's very important first time, if they're not experiencing anything and you think you kind of expect them to because they're pretty sensitive, you just take your time. You know, you might do a couple and then wait a minute, you know, just chat with them, wait 2 minutes, you'll gradually intuitively learn when to take time. And sometimes, if I'm not sure, I'll treat someone for a certain amount, and then I'll have them go in the waiting room, and I'll see my next patient and then check in on them. So that's another way you give yourself flexibility. And you particularly don't want to overstimulate someone if they're a child, because they won't want to come back. So really, really take it slow. That's why the first sign, you just stop. Usually the first sign of relaxation, maybe I'll do one more. If they're hardy, I might do one more. But no more than one more. You just stop the first time. Just stop. It's, I was an ER doc. I'm kind of aggressive, and I made that mistake quite a bit in the beginning. And it's not that overstimulation in and of itself is that bad a thing. They get a little spacey, a little tired. It's not that big a deal. But we find that we make the fastest progress when there's minimal side effects, when we match what we're giving to the sensitivity of the patient. Now, one mistake, I just got an email today from, and I get these from time to time, from someone who saw a lens practitioner. And the person was getting treated 3 times a week for 8 months too. Was terrible. Was feeling worse and worse, and the practitioner apparently told this woman, "Oh, it's got to get worse before it gets better." It's baloney. It doesn't need to get worse before if it's getting worse, it's because you're giving too much. Now it can temporarily, but it almost always means you're giving too much. But we're still in the first session here. We'll talk about the implication more with the following session. So you take your time. You're in no rush. See, this is why, because I'm taking my time, you're able to talk with your patient while you're doing this the whole time. So there can be more you want to say and talk about with the patient while you're doing this. So you don't necessarily have to get everything before you start. You can get whatever background material, you can get it over a few sessions too, because you'll talk. Okay, so this, you have a good sense of what to do. I mean, that's the first session.
You keep about an hour for the first session?
Yeah, because I don't know, I usually end up spending about 45 minutes, and it depends on how much they want to talk, but usually with a brand new patient who doesn't know anything ahead of time, about 45 minutes.
And then for subsequent?
Half hour. I do half-hour sessions. Okay, now the second session, and this is for pretty much all follow-up sessions. The second session is where you really have to use your clinical acumen, and where skill and experience matters more. You have to elicit a history. If you say, they come in, you say, how are they doing? Well, what's often the case is that they're doing really poorly, because whatever benefit they got is probably worn off. So it's really pretty irrelevant how they're feeling, actually, when they come in. The key to taking the history is that it's a chronologic history. And that's how you take it. Okay, what happened that night? What happened the next day? And of great importance is how long it lasts, because that's going to be one of the key factors that we evaluate in determining progress. So, but generally this side effect won't have lasted that long. It generally is from a few minutes to a few hours. The way I say it is, it typically lasts from a few minutes to a few hours, sometimes a day, and rarely a few days. But it goes away 100% of the time. And you reassure them not only that it goes away, but that now we lower it, what we give, and so it's not going to be an ongoing problem. They may say, well, I didn't notice anything. Well, then you may have to go through the history with them, because there's several things. One is they noticing how they feel, but the change may not be in how they feel. It may be in what they did, an activity. And if it's cognitive, it may be neither. It may be, the change may be they're able to do a homework assignment where they couldn't before. This is particularly true, though, about no change in feeling when people are depressed. Because what I find is when you're depressed, you're down here, and you're not going to feel better until you're here. But there's this whole gap in between where you can improve but not feel better. So in that case, it's particularly important to go through behaviors. I had one woman who really was quite severely depressed and commonly felt suicidal most weekends, and was her usual suicidal self this weekend, but she said, oh yeah, there was something different. I called a friend for the very first time. Okay, so that was the one change. So it's an activity. So people with depression, it may be, well, did they call someone? Did a family member? Did they go out for a walk? This is why you have to walk them through what they did each day. And this is also why it's easier to treat them twice a week initially instead of once a week, because they remember it much better if it's just in the last few days than if it was a week ago. So when patients leave after the first session, what I tell them to pay attention to is, one is how long it lasts, and two is notice if anything surprised them. So you're framing it in a positive way. Example, traffic may usually irritate you, but it doesn't. Your kid gets angry at you. Usually you're frustrated for hours. Now it lasts only 15 minutes. So in eliciting this history, it's important to remember that improvement is relative, not absolute. Meaning that if they came in for anxiety, they may think they're never going to experience anxiety because of treatment. No, it's more likely, well, they have some anxiety, but it only lasts 15 minutes. Or they recover more quickly. They'll have emotional resilience. And in the future, as you're going forward, the reference point will be how they responded to an obstacle. Well, compare it to how you used to respond, even if you're not responding well. Is this still better than before we started treatment? So improvement, it's relative. Some people are really poor self-observers. I find that teenage boys are really often terrible self-observers. So especially when it's children, it's really helpful. You need the feedback from the parents. Was anything different? Or a spouse. And then did they do anything? You know, they may say, well, they didn't feel any different. They didn't do anything. You really have to go through the day and have to go, well, is that how long you typically get irritated? No, and then they'll say, oh, no, maybe, yeah, that was a little quicker. You really have to elicit it and go through a history, and it's different than the kind of history you're used to doing. In a way, it's more typical for me as a physician, taking a history this way, you know, chronologically, and trying to get really the specific characteristics of whether it's abdominal pain or chest pain or, you know, quality of breathing. I need one sign that things are better. That's all I need. And I know we're going in the right direction. I just need one thing. And then you go to your symptom list and check it, because they may not be thinking of one or two of the symptoms that they've given you. And then when they do come into the second session and they tell you they had the headache and they didn't get anything positive, you say, good, your brain's responding. The only thing you really don't want is nothing happening. So you frame overstimulation as positive, the brain's responding. And we just have to cut it back a little. And it's pretty much true. If someone has a positive response, the end's going to be good. It's not like they respond initially and then aren't that well in the end. This is, you know, all's well that begins well. So your goal is to match what you're giving to their nervous system. You're not particularly trying to be able to give them more or less. Though, what we commonly see is if someone is super sensitive to begin with, if they improve, they'll frequently become less sensitive, less reactive. So, more about in taking the history. A patient may say, well, you know, I developed a headache. I got a headache from it. And you ask, well, when was the headache? And they say, well, 3 days later, 3 days after the treatment. It's 3 days after treatment, it's not from this, okay? It'll be the 24 hours, okay? And generally, again, those symptoms will, if you're going to get side effects, you're going to get them. It's not usual that you get a positive effect and then negative overstimulation hours later. And then what you do is when they are overstimulated, then the key point to look at is what happens when the overstimulation wears off, because that's when they're most likely to see the benefit. They're not going to see it while they're overstimulated. So direct your attention to that. Now, and it may not last very long. It may only last a half hour. It may only last an hour. You know, it's usually more. It's usually half a day to a day or two. But one woman I treated for depression, she only felt better for a half hour at first, then an hour and a half, and then about 4 hours. And by the time we were done, I think she took like 23 or 24 sessions. So it was more than average, but not you know, really out of the ballpark figure. So it really doesn't matter how long you'll build it up. I mean, it'll go quicker if it's longer, but you'll still be successful even if it isn't very long. Okay, another important point is, in general, people have their best session the first time. It'll be most dramatic. And it's generally never as dramatic as that again. So there's a plus and a minus to that. The plus is that it's very clear the patient knows something very real is happening. The negative is it's easy to get discouraged. I call this the fall from heaven because it's never going to be as good again. And they may keep comparing each session. They may be improving, but just have a sense of regret because it's not what it was. So it's really important to then redirect their attention to the comparison as to how you started, not that one session. So sometimes it becomes a problem because no matter what you say, they'll still have that real high expectation. So if someone has a great first session, you know, I'll say congratulations, enjoy it while it lasts because it's not going to be that good again. Because otherwise they'll think maybe it's now not working so well. I find the most reliable indicator is how long it's lasting. So that's the single most important indicator. And it directs you to how much you should be giving that person. So what happens if you're going along and it's lasting 3 days, then 5 days, 6 days, and then all of a sudden it's only 4 days? That almost always, 90% of the time, means you have to give them less. It's counterintuitive. You don't give them more, you give them less. So in this case, it's less is more. And I find that it's better to make a big jump less, at least drop 50%. And I often do more because I find it can become a problem if you give less but it's still too much, and then lessen it but it's still too much. I'd rather go too low and then build up. And what I sometimes do is give, if you're not embarrassed by how little you're giving, you may be giving too much at that point. What I do with my patients is I give them really low, and I say, look, if this is not enough, you know, come back tomorrow, the next day, and I won't charge you. So I find that that it's better to get below it and work your way up. And I found most of the time when I think it's too low, it's actually been the right amount. So this is a really important point, and we'll go over it again tomorrow because this is something you'll commonly see. So people who start out fairly insensitive or medium insensitive, they will commonly become more sensitive and so need less. So that's what's happening. They're becoming more sensitive, and that's why they need less. And that's the way it manifests, is by duration. It's the most obvious way, by duration shortening. When I treat, my particular approach is to, in terms of frequency, it's a function of how long it's lasting. So I start twice a week. When it's lasting a week, you know, I'll see him in a week. When it's lasting a week and a half, I'll see him in 2 weeks. So I see him more in the beginning than towards the end. And one of the benefits of that is it's clear if it's not lasting as long. If you're treating someone twice a week and or once a week and just do that week after week, once it's lasting more than a week, let's say it's lasting 2.5 weeks, and now all of a sudden it's 1.5 weeks, you wouldn't know because you're treating them every week. And I think that's what happens. I suspect that happens a lot because it's one of the few reasons I can imagine why someone is treating so frequently. But on the other hand, if you're seeing them once a week for therapy, it makes sense to do that. So what I do is, you know, you can have them come in a second time in the beginning. You can, you know, then cut back. You can cut back to, you know, doing it every 2 weeks, you know, and just doing regular therapy. Or you can do it weekly and then at some point, 6 or 8 sessions, you know, just stop for 2 weeks and see how long it's lasting. So there's various ways to work with it. The other reason I like doing it the way I described is gradually lengthening them out based on how long it's lasting. One is in the beginning when it's most important is people's memory. they remember better. And in the beginning, you're teaching them how to tell you what you need to know. You're teaching them what to look for. Later, they know. And what's nice also is when they come back, they really want to see you. They need a treatment. They're starting to feel anxious again, all right? And so when you're seeing them every week, they may just be doing fine. And, it's not as big a deal. So I like that factor in it. I also like sometimes that to see it wear off after a while, because they tend to forget. They get used to it. I find that there's, in general, 3 phases to someone's treatment. The first phase is quite short, and that you're not sure whether it's placebo or not. Well, maybe you're just having a good day or a good week, and that's why you're feeling better. So you're just not sure. Then what happens, that quickly goes to phase 2, where it's lasting longer, and you're seeing the pattern of you feeling better after a treatment then starting to wear off. So you know that something real is happening, but it's too good to be true. You feel it's not going to last. That's phase 2. And phase 3 is as you proceed with treatment and it's really lasting longer and patients get used to it. One of the most common statements I hear is they feel more and more themselves. And they will often, you'll be surprised and amazed at how often they'll really forget how bad they were. And so I'll ask them at the end of the treatment, well, do you think HPN helped? They'll think and they'll say, well, maybe a little bit. So I've always planned on taking an interview or filming something in the beginning because they look so different also. But you often have to go over their symptom list, things like that, just to get them to remember. And even then, they won't. Some will really viscerally remember, but more often than not, they don't. So those are the 3 phases. Okay, so sometimes less is more, and sometimes more is more. So sometimes you're going along treating them, and they're getting less out of it. The effect is kind of diluted. So it's more of a diluted effect, less effect than shorter duration, though it can be shorter duration also. But in this instance, you usually need more. So sometimes less is more, sometimes more is more. Sometimes you try one, and if it's not that, then you go to the other. Sometimes it's not always clear cut. So let's say all of a sudden, patient is really bad. They're just getting bad for reasons, they're having worse side effects, or old stuff that's been doing well is suddenly, getting worse. Well, then you have to look for a reason. And that's when you go, look, did you change any medication? Any supplement? Did your doctor put you on a new medication? And then often it's hormonal. And certainly with menstruation, I find that really generally trumps this. It's HPN is no match when it comes to compared to having your period in its effect on the body. So asking about that. And also the person, this is because you're not a physician, but because of what else is going on medically. It may be, a lot of the people you'll see, they may have fibromyalgia, they may have a variety of things. So it may be that if you can't figure it out, you suggest that they go see their physician. Because it's not just, when there's really a dramatic change, when everything's been going along, it's really not because of too little or too much of HPN. So it can be other medical conditions too, and it can also be inflammation or infection. Sometimes that temporarily undermines the effect. Sometimes if a person's status, hormonally, whatever, is really unstable, I'll stop seeing them for a while until it does stabilize. progress can be really slow in the beginning. The first 6-8 sessions. I find that it often doesn't really start building duration to a significant degree till it's lasting somewhere between 1 and 2 weeks for people, for most people. So it may take half the total number of sessions just to get to a week or a week and a half. But then it starts building rapidly. So don't get discouraged if you're not seeing much progress initially. Just remember, if you've had a good response, you'll end up with a good outcome. You just have to figure out how to get there or be patient enough. But basically, everyone you treat who has a good initial result should have a good outcome. And if you're not, then call me or get help from somebody, because they should. The other thing is when they start forgetting appointments, and it's law of diminishing returns. And so, your patients will ask, wow, you must do this every day. And, you don't notice it much after a while. And so they'll start to not want to come. Because then they're paying and not getting much better. So that's when they're done. And then they come in on just an as-needed basis, right? So the time basis for checkups. And now some of the things that I do, you may want to incorporate something like this into your practice. One is that if I'm not sure, but I'm curious with someone whether or not I can help them, what I'll commonly do is make an agreement that we'll do 3 sessions. And if it doesn't help you, I won't charge you. But if it does help you, then I'll charge you from the first one. That way I get to learn something and they get a good deal. Because they're either getting better or it doesn't cost them anything. And that's one of the beauties of this. You get to experiment. You can do a lot of things because it really doesn't take much. It's not like you're starting therapy with someone. I also have a policy if someone's not showing improvement by 6 sessions, certainly in the beginning, I stop charging them. And I'll continue to treat until they start getting better, at which point I'll start charging them again, or else we decide it's not going to help. So maybe half the time I can, third to a half the time I can, start getting. But in general, if they're not getting better by 4 sessions, actually not noticing anything, more often than not, you're not going to be able to help them, unless it's something that you really think you should and you don't understand why they're not. Like just acute anxiety or something like that.